So there you have supply chain management system. But logistics system is talking about the individual movement of this commodity, right from the point where you source it up to the point where it will be utilized. But you'll agree with me that for medicines, there's still noise at the back there, please. You'll agree with me that for medicines, we have to go even beyond the time we will take it to the patients, I mean to the end users. We have to think about what this medicine is doing to our patients. That's why the concept of supply chain management system for medicines is extended to include other areas. And that other areas is what this medicine is doing on our patients. It is because we are not living up to our responsibilities in this area, because if you dispense any drug to any patient, your responsibility will include following up to ensure that this drug does not cause unnecessary harm on these patients, or even if it does, you have the information about the harm that is causing on the individual. And then you take care to manage that harm, and then you take care to see that that kind of harm is minimized in the future. Okay? So what is the aim of logistics system? The logistics system, anywhere you see logistics system, is aimed at ensuring the 6 rights of logistics. We call them the 6 rights of logistics system. They are enumerated here. Okay? The right, this includes right products. We need to have a right product, that's right drugs or right medicines or right commodity in our facility. And please, this facility may be a community pharmacy. It may be, okay. It may be your health facilities, because if you are operating at the health facility, you are talking about your health facility. It may be the whole state health facilities, like people like all that are operating drug and medical supply agencies. We are looking at this product, I mean this right patient to be all those health facilities that are coming to source their product from us. We have to ensure that we give them the right is there is missing. For example, imagine that you are giving patients product that is of poor quality. What are you doing? We are not achieving anything. So it is your duty as supply chain manager to ensure that the commodity you are giving, the drug, the medicines you are giving to your patients are of good quality. And you give them the right product based on the prescriptions or based on their request if they are coming from various health facilities. It is enumerated like right products must be provided to achieve any pharmaceutical care. Okay? The products are decided by the type of interventions or the outcome we are trying to achieve. See, the right products depends on the kind of interventions we are trying to achieve. For example, if you are talking about HIV programs, the right products here will be the antiretrovirals and the other items that you use for opportunistic infections. And if you are talking about malaria programs, you are talking about products that are required in those areas. You cannot take HIV commodities to malaria program, for example. And if you are talking about other like nutrition and other health programs, you are talking about specific commodities that are specific for those programs. Then the right quality of the product must be provided to achieve the desired outcome. So if after all, see, after counseling all your patients, after doing everything in your pharmacy, at the end of the day, you give patients a product that is of poor quality. All the work that you have done, it will be zero. Even the work that is done by other healthcare workers, it's going to be zero. So please, that's why I want us to take this issue of supply chain management with all the seriousness that it deserves. Because the public trusts us to provide these quality pharmaceuticals and other health products for their own usage. Therefore, if we are not careful to manage our supply chain management system effectively, we will end up not giving people, not living up to the expectations of the people. Then the right quantity is talking about correct dosage. For example, if you are giving to an individual, or enough quantity that will last a particular time frame. For example, you are supplying your health facilities, you have to give them quantities that will last them a certain period of time. Like at agencies, in our various agencies, we give facilities something that will last them for about 2 weeks, depending on the program. And then for some programs, you give something that will last for about 2 months, some for even 4 months. Okay, that's about the quantity. And then the product should be at the right place. This right place, please, we have to understand that in our pharmacies, okay, 15 minutes or 5 minutes I have. Surprising. Okay, I'll see what I can do. So all these rights are the rights we are talking about, and they are self-explanatory. I don't even have to be wasting my time. I was thinking I would have 1 hour to discuss this issue. I didn't know that I have only 10 minutes. Thank you. Okay? So the components of this supply, in supply chain, we have this what we call logistics cycle. This is the process that takes place in supply chain. These are the components that we care most about supply chain. We talk about serving customers. We talk about product selection. In our health facilities or in our pharmacies, we look at the product that we select. And coincidentally, even for the traditional, even for the TCAM, supply chain must play an important role there. Otherwise, all the help that we collect, if you don't give a good supply chain management, they'll end up wasting. Okay? For example, you provide your herbs and they have specific storage requirements. That's supply chain management. So if you don't provide the necessary conducive atmosphere, you'll end up wasting a product. So product selection, forecast and procurement, you have to do forecasting and then you do the procurement. You forecast about the time it will take you for the particular period of time. And then inventory management, which includes storage and that's my distribution to the serving customer. These serving customers, it can either be a patient that will come to your pharmacy or health facility that will come to collect from you. This is the process that takes place for logistics, for supply chain management. We first start with forecasting and quantifications. The only difference between forecasting and quantification is that of cost. By the time you put cost element on the forecast, then that means you are talking about quantifications. And please, I want to emphasize that many of us that have been doing supply chain management is because we don't know what we should be doing. For example, in your pharmacy, you're supposed to be making forecasts about quantities of commodities that will last you a certain period of time. That forecast is very, very important so that you can make adequate planning to see how you can procure it and then source it. And then procurement is what we are doing every day. Then warehousing. Warehousing has a lot of process, but fortunately this paper is just our sensitization. We just want sensitized farmers to understand this issue of supply chain management system so that they really go back and read through it, and like AZUBUIKE mentioned, discussion is ongoing between the PCN, the PSN, and even the academic. Pharmacists really consolidate on their graphs on the supply chain management system of health in the country. Okay? Now, after the last mile discussion, we'll talk about the usage, disposal, and pharmacovigilance. This is because you don't just push out commodities to your patients, you have to follow up to see what they are doing there. Okay? We have, in the country, we devise so many strategies to ensure effective supply chain management. If you begin from different policies that are enacted in this country, beginning from 2006, there's this issue of national policy on supply chain management. They are talking about how we can really take ownership of our supply chain management to see that at least whatever is coming into the country or into your state is really well documented and it's well taken ownership. The state has taken ownership of the whole thing. It's not like before whereby you are staying in the Ministry of Health as Director of Public Service and then some people are supplying commodities to various health facilities even without your knowledge. They see the danger in this. Therefore, there is so many reforms now to see that at least the country is taking over, is taking ownership of its supply chain management system. Okay? So because of so many policies are developed, we need to also understand the dynamics of our supply chain system. Those of us that are operating agencies and those of you that are managing health facility supply chain management system. Then proper documentation cannot be, must be emphasized here because if you don't, what we are lacking is documentation. There's need for proper documentation because without documentation, you cannot know your history of consumptions and you cannot know which commodity goes to certain area. This thing is very, very important because sometimes there may be recall of some products, maybe based on their batch number. So we need to document the batch numbers and all the information about that particular drug items so that in case of any issue that may arise after distribution, you may be able to know that I supply social commodities to social area. Okay? Then we need to employ different technologies. There are different technologies now in our possession that we can use to effectively manage our supply chain management system, like M-Supply, Navigation, and all those ones that you use to manage your inventory. Okay? And we need to continue to research in this field. And pharmacists should take over this issue of research on supply chain management because other professions are not just looking at this issue. because there's a lot of resources on supply chain management system in the country. So many programs, they now ask for pharmacists to be the supply chain advisor for their programs, even IPs. So, but if you are not careful, there are some other health professionals, again, in the country that are also looking at this. If we don't consolidate to bring in all the other health commodities, we should not just, we should not regard only drugs and other consumables. We should look at other reagents, laboratory reagents, and other equipments and instruments. So all those is very, very important so that at least the issue of supply chain management, once you mention supply chain management, you'll be thinking about pharmacists. Okay? So supply chain management is effective if there is access to quality commodities that are available at all times in a sustainable manner. So that's when we can say that we have effective supply chain management. Okay? So it's a golden opportunity now for pharmacists. Supply chain management, as I mentioned, is a golden opportunity for pharmacists. We either take this opportunity, or if we are not careful, I see a situation whereby other professionals will look at the opportunity in these supply chain management systems and take it over from us. Please, this is my clarion call, and I wish you all. Thank you very much. Thank you.
Thank you very much, Mani Mohammed. Mani is a practitioner. Mani, let's introduce you properly, because you are the general manager of the KATSINA State Drugs and Medical Supply Agency. So he knows what he's talking about. We need many more pharmacists to join Mohammed. Many more pharmacists. But I can see here that we are more interested in elections than what we're doing here. We have here with us the lead speaker, architect. Am I right, sir? Okay. They wrote architect under your name. AZUKA, OKEKE, is it? Are you AZUKA, sir? Huh? Oh, you are ESUGA. Do we have architect OKEKE here with us? Oh, okay, thank you. Okay, so who leads? So let's leave. Is it joining, or you are going to? Okay, please, we're running short of time. We want to apologize to you. I don't mind the pharmacist with us. What is happening here is that we shouldn't be in this kind of hall. We shouldn't. It's not a must we come to Port Harcourt for this conference. I don't like the environment, but I hear it's an emergency. The governor canceled something we were supposed to use, and we can all understand. So I apologize to you. AZUKA OKEKE, please, is the lead speaker. You can introduce yourself when you come up. Come. Thank you. Tell them who you are.
Thank you. Good afternoon, everyone. Standing on all existing protocols. First, I would like to say that I'm actually not FARM AZUKA OKEKE. My name is Chinyere Zibe, and on behalf of FARMAZUKA, I would really like to apologize that she couldn't be here today. She had an emergency meeting. And I will be presenting on behalf of my company, or my organization, our organization called Africa Resource Center for Excellence in Supply Chain Management. So it's ARC-ESCM, actually. And so what I will be talking about today is pertaining to the topic of the session, the plenary session, which is availability of essential medicines. And I'm just going to speak a little bit on who we are, who ARC-ESM, who we are, and how we currently support the government and also the local pharma companies in ensuring that there are availability of commodities. So I think just to start by saying, explaining who ARC-ESM is. So ARC-ESM is an organization that has set up resource platforms that can support government, or that is specific to supporting the government and its partners to achieving or assessing private sector expertise when it's related to supply chain management. And I think this is a very good opportunity to speak on the supply chain system, particularly as it's very key when we talk about availability of commodities or availability of medicines. I think when I say that a sufficient and efficient supply chain system means availability of commodities, I believe everyone here would agree with me. Being able to have a strong supply chain system can improve the movement of commodities from one phase to another, thereby ensuring that there are availability of medicines at the last mile. So just speaking a bit, like I mentioned before, we have resource platforms made available to the government and partners to assess private sector expertise in supply chain management. Now, just speaking in relation to the support that we provide to the government, we currently, through one of our resource platforms that we call the private sector membership platform, we have been able to provide support to the government in entering PPPs with local pharma companies. And the reason why we're doing this is to diversify the supplier base of the government. I think when we think about these PPPs, we think about the reason, the why, the objective, which is to make sure that there are commodities at the last mile. Now, these PPPs that we are fostering with the local pharma companies and in partnership with the government would ensure that commodities are available at the last mile. Currently, we have successfully facilitated PPPs between Yobe State, Kaduna, and Niger State. And the local pharma companies that we have successfully fostered partnerships with these states, we have worked with FPSN, we have worked with NIMEL, we have worked with May and Baker, we have worked with a lot of other companies in fostering these PPPs with the states. And now when we talk about the support that we are providing to the states, in as much as the government, they are becoming more open to entering these PPPs with local pharma companies to diversify their supplier base, I think it's also paramount to note that even as local pharma companies, you also need to begin to get ready to work or go into this partnership with the government. And I think for us, what we mean by getting ready is that the first thing would be to think about working with the government beyond more than just the trade. Think about it as being able to influence the supply chain system, being able to give key knowledge or key inputs into the supply chain system of the government, being able to suggest to the government or advise to the government on availabilities of commodities and order rates and reorder rates. And just speaking again on one of our resource platforms and how this resource platform has been set up to support these local farmers in getting ready to work with the government. We have one of our resource centers called resource platforms called the Center of Excellence Platform. Now, like the private sector membership platform, what it does is that it fosters PPPs between government and local farmer. Now, this Center of Excellence platform, what it does is that it also provides resources to the government and also to the local farmers in terms of strengthening their skills. So skill strengthening, internal skill strengthening of local farmer companies to ensure that you're able to provide this support to the government when the time comes, to ensure that you're able to make informed decisions to the government when the time comes. Just to, like I mentioned, the companies that we are working with or that we have worked with in the past and currently working with, FPSN, May and Baker, NIMEL, and Juhel, they are all beneficiaries of these platforms, the private sector membership platform and the Center of Excellence platform. So it's really, I think the conversation needs to continuously be had over how we can, in our different sectors, help to ensure that availability of commodities remains a constant. And I think you would agree with me if I say that being able to make sure that commodities are the last mile requires a lot of collaboration between the sectors, between the governments, between the local pharma companies, and between other key stakeholders. Thank you.
Thank you very much. Can we give her a round of applause? We'll have questions after the last presenter, speaker, but you can all agree that it is important that pharmacists begin to key into the supply chain initiative, the concept. And I know that many pharmacists are already in there. I want to recognize somebody. I want to recognize one or two persons who I think are leading in those areas of supply chain. One is our newest fellow of the FIP. Shola is our newest fellow of FIP. He's here with us. Shola, can we give it to him? He's the second African to be so recognized. Then Mrs. Okafor, I don't know what is it you did with supply chain again, and you're still doing with supply chain. So maybe during the question and answer question, we'll get to know what she's doing with supply chain. We're going to have the last speaker, EMMANUEL ESUGA. Is it ESUGA? He's a pharmacist. I'm not going to apologize for the heat here. So please come up and tell us what you have for us. Thank you.
Good afternoon, all, and I'd like to stand on existing protocols. So the last two speakers have done justice to the technicality of supply chain, and I think a very important benefit of a thriving supply chain is that it improves care, it enhances care. Because if you design all those things and it doesn't lead to health outcomes, then we can't say we have a thriving supply chain. And of course, to enhance care and have a thriving supply chain, financing is required, policies are required, as well as commitment of the actors within that space. How do I move it?
Please to move it.
Okay, all right. So, this is one type of supply chain. Okay, so I guessed as much that there will be people who give us the technicalities, all the calculations about supply chain. But I want to bring a little perspective to what supply chain is all about. Remember I mentioned that to have a thriving supply chain, finance is required, policies are also very important, and then there must be commitment. With policies, we come out with guidelines and procedures on how the actors in that space are supposed to carry out those activities. Sorry. I need help. Okay, the bigger one, right? Up. Okay, down. This one. Okay. All right. So, by introduction, I don't know whether I should bore you guys with this. I'll just move on. So, there's something very important here. This has been talked about already. So, the issue is quality matters. Very important. And that is why we want to secure the supply chain. The supply chain is supposed to be the means, the framework to lead to access to quality assured medications or products or medicines, as the case may be. So this is a WHO study that they did a couple of years back. This is in low and middle income countries, and Nigeria is one of such. And as at the time they did this research, they said the cost of substandard medicines annually is about $30 billion. $30 billion. You know, so like the picture there is just the tip of the iceberg. What are the impacts? There is what? Increased mortality if your supply chain does not deliver. we know mortality increases, morbidity increases because of substandard and sometimes falsified medicines that come into that supply chain within the country. Then, of course, there is economic impact. These days, people take AL for malaria, the first round, and they are not feeling better. We don't know why that is happening. They move on to other products here and there. There is a cost implication that is involved if your supply chain is not secure and is not meeting up with the standards. Then, of course, there is the social aspect of it. If you spend more, we know where we are in Nigeria in terms of the prosperity index. I don't want to call it poverty index, but these are things that affect us here as a nation. Having said that, I'm talking about the impacts because this is very important. Summary here is showing us that they did a study. This is like a meta-study of series of research that has been done. And from that report, you have 13.4% of injectable antibiotics that failed. They were substandard. They were substandard. And that is very critical. And then the uterotonics, oxytocin, misoprostol, and all of that, they came up with a failure rate of 48.9%. And in terms of maternal death, Nigeria is also is doing very poorly in the indices. What this simply means is that if a woman presents to the hospital, if they give her that oxytocin and it's not working well, women will have needless C-sections that they ought not to have with the attendant complications that come with it. So we have a Nigeria scenario that we did with NAFDAC. This was around 2017, 2018. We carried out a post-market surveillance in collaboration with NAFDAC of maternal and child care products in circulation in the country then. The failure rate for oxytocin, for example, was 74% in circulation in Nigeria. And we followed up with that result with a study, a localized study in Lagos State, where we had to do a survey of health facility in the whole of Lagos State, and the figures were consistent. In fact, when that report was disseminated, the directors, Food and Drug Services, all the big people were in that meeting at Sheraton there in Lagos. So this is a Nigerian situation on ground a couple of years ago, and I'm not sure it has improved significantly. I know that the agency swung into action and they started insisting on the requirement for cold chain facilities. Now, COVID has come and is making it more pertinent that some of these things need to be addressed. So, like I said, I'm coming from a different angle, and quality assurance is very important. Even your supply chain, there are requirements. There are quality management systems that need to be put in place. The structure and the facility is one. The system of operation is also another major requirement to deliver on your supply chain. So, in a nutshell, this is what your supply chains are. This is what it is. You have international manufacturers. They could be manufacturers of components, packaging materials, excipients, APIs, finished pharmaceutical products, vaccine, etc. So they want to come into your country. They want to come into our country. So you have an array of several regulatory authorities. Why is that important? Because they are supposed to come up with the standards. And we are talking about international standards on how these things should be carried out and implemented amongst the stakeholders within this space. So you have the international manufacturers coming into your space. You have the points or ports of entry. Those are all part of the players within the supply chain. Then you have local manufacturers who maybe receive components from those international manufacturers, and then they go through their own processes. Then you have the health offices, the ministries, you have the wholesalers, you have the retail pharmacies, you have the healthcare centers. We talked about the last mile. This is just a summary of what your supply chain. Within all of these areas, I want to call them practice areas within the supply chain. There are international conventions and standards that should be adhered to, which our regulatory authorities are also doing their best to ensure. So, health and well-being of patients, families, communities, and populations. That's why you must have regulation. You know, the supply chain, you have so many players, and it gives room for compromise. So if there is no regulation, and if there is no enforcement, you get to see some sharp practices within that space. High market value is important. Okay? High market value of products is also a key factor. We normally say that it is a product that is successful that is falsified or cloned. Hence, the need for regulation of products. Then consumers do not want to have the necessary information about quality or when or how or which medicines to use. They can't determine it. Sir, if I come to your pharmacy, I trust you that what I'm buying from you is of quality. I don't have any means of determining why it is. But there are things in the regulation that govern how you practice. And that is all geared towards ensuring that the products within that supply chain, you are in that outlet, you are meeting the people at the last mile, and we are sure that we can access quality assured medicines. Okay, I've been asked to move faster. So we know this, we know who they are within our space. So this is the interrelationship. At the point of entries, you have all the agencies, including customs, including NDLEA, you know, and then by the time it comes into the country, there are also other players. I've just listed this now. Let me just move on. So, products must come in. Finished products. Role of regulators. You must apply for market authorization. It's all part of assuring and ensuring that there is access to quality medicines. You must meet those requirements. You must meet those requirements at the manufacturer level. For the manufacturer, you are talking about GMP standards and all the good practices that assure that medicines are produced and they meet the required quality. And then at these circles, these three circles, that is also at other practice level where regulations, licensure, and inspections takes place. We have a regulatory authority that is saddled with responsibility of licensure. So before they can license you, there must be minimum requirements that you must meet. So these are all factors that are designed deliberately to ensure that your supply chain increases access to quality assured medicines. Post-market surveillance. In the previous slides when we talked about the outcomes, quality outcomes, the impact, you only get to know this through post-market surveillance. From the factory, it may not be a problem. You know, for that survey that NAFDAC did in 2017 for oxytocin, it must have passed at the time of release. If not, it will not be released into the market. But what happens from the facility to the last mile? Compromise has come in. Why is that so? Because the standards were not enforced, or they were not there ab initio. You know, so that's why regulatory and quality assurance systems is key in delivering on supply chain. All of these people in circle here, they are subject to post-market surveillance at various levels. At various levels. So, as an organization, we are USP, that's the United States Pharmacopeia. We also implement a USAID-funded program known as Promoting the Quality of Medicines Plus. We also provide support to the regulatory agencies in country along these fields: licensing, inspection, registration, laboratory testing, and of course, risk-based post-market surveillance. So, sustainability is key. For whatever system you design, you should have sustainability at the back of our mind. You know, and it's the ability of a local system to produce desired outcomes over time, such that it's resilient, is adaptive in the face of change and of changing circumstances. So this is very important, you know, because we are donor-funded project. They also spend a lot of money to help countries like ours to improve the health outcomes. And so systems must be designed, systems must be robust enough to deliver on these requirements. These are some activities we've carried out over the years in terms of providing technical assistance to organizations within the country. So, what makes a regulatory system sustainable? Resources is important. Your processes must be efficient. And how do we achieve that? We want to benchmark with international standards. And today we understand that NAFDAC is also pursuing maturity level 3 for regulatory, medicine regulatory authorities. That is the way to go. We can't go below that. Good governance, very important. There must be a governance structure in place where people must commit to it. Governance is key. We want to see what the structure is, what are the policies, and how is it implemented, and what is the monitoring and evaluation framework that is in place to ensure that those things are monitored, they are carried out, and they are implemented based on certain indicators that have been designed in that work frame. Enabling policy, legal and regulatory framework is also very key. And like I said earlier, commitment to implementing those policies is also very important. So these are some activities we've done in the past, just to share this. So we also have an e-learning platform today for practitioners in the space, and you can go to some of these links for such trainings. So product regulation, quality assurance require a systems approach. It cannot be a knee-jerk approach. You are looking at the whole system. All players in that stage must meet those requirements. As a result, there are many points of vulnerability and many opportunities to strengthen the system. Sustainability can be built into regulatory and quality assurance systems. Of course, financial reliance, an adequate, competent workforce, good governance. Again, governance, governance, governance. I'm told that Nigeria, we are not bereft of policies, but the challenge is what? Implementation. And that is where the governance comes to bear. We have beautiful paper, policies, but implementation is very important. So thank you for your time. If there are questions, over.
Thank you. Thank you. Can we appreciate our three beautiful presenters? For me, what I got here is that supply chain concept initiative is about maximizing the value for customers. Maximizing the value for customers. But what I want everybody here today to do, whether you are new or old to that concept, but especially for those who are new to the concept of supply chain, please go back home and just do a Google of the history of supply chain and then supply chain management systems. It's important to begin to appreciate where even our practice is going. Mani Mohammed is a practitioner, he's a pharmacist practitioner. ESUGA is the chief of party, he's a pharmacist. He's barely practicing supply chain in a way. And then this company, SCM, am I right? ESEM are also in the supply chain space. There's no limits to what we can do. Just before we came on board, we talked about traditional, complementary, and alternative medicine. So much opportunities for pharmacists. So much opportunities. We want to take 3 questions, just 3 questions. If we have any questions, yes, Shola is one. If we have 3 questions, or 2 or 1, yes, Shola. Okay.
Yeah, thank you very much. My contribution will be by way of a comment and a question. First, I want us to appreciate again the privilege we have to have in our midst AZUKA OKEKE. She's not, though she's represented. I belong to the expert pool of ARC, and I know AZUKA as a thoroughbred supply chain practitioner is one of the leading global influencers, female influencers in supply chain globally. So we are really privileged to have her, and I'm sure Chinyere has represented her very well. If we have to count 5 people who are leading authorities in current good manufacturing practice in Nigeria, ESUGA will be one of them. And we can't make light of his experience. He has developed a WHO pre-qualified factory while he was at CIFA. And the work they're doing in USAID is to support various functions in the supply chain to achieve global standards. And we thank both of them for coming and giving us this opportunity to listen to them. So going to my question, I noticed the 2 speakers, I dare say the 3 speakers, didn't mention anything about environmental sustainability. It's becoming a key issue, and these days that Nigeria is aspiring to competing globally. If we don't take it on immediately, we will find that our products, even though they're of quality, if they don't meet certain environmental indices, will be shut out of the international space. So I'll be willing to listen to their comments. Thank you.
Okay, you want to respond? All right. Any other question, comments? Okay, so we take your response, please. I have my question. I will ask after the comments.
Thank you very much for this important question, because even though the question you asked is really not on supply chain management, but I want to speak on this area because we are talking about sustainability of our supply chain management systems. We all can remember that in 2020, for so many months, the country was virtually locked up. Commodities were not coming, and for most of our supplies, we depend on imported drugs and other commodities. So during that pandemic, the country suffered a lot of issues with regards to supply of commodities. So we are not just even talking about what we are producing here in the country that we can take outside. We are talking about the way we can sustain ourselves in the event that commodities are not coming into the country. That's what we call resiliencies in our supply chain management system. We are, in Nigeria, is what we have been clamoring for, to see that we develop a supply chain system that is resilient, that can stand the test of time, that can stand the test of time in the event that we have calamities, we can be able to at least supply the basic needs in our country. So that's what we are talking about. Thank you. That's what I want to comment. Thank you.
All right, ESUGA, after that profile, you need to deliver, I beg.
Okay. My guy, you have put me into trouble. So, yes, it's not mentioned directly. But remember, we kept emphasizing best practices, international standards. Because if we imbibe international standards from the beginning, we'll compete with the world everywhere. And so, there are requirements. Disposal of expired products, disposal of waste. Those medical products, they come under various chemical entities. So you must know how to dispose. You must know how to destroy. You know, so, and I'm sure some states in Nigeria where you have facilities, it's mandatory from the Environmental Protection Agency of the state that you have a functional effluent treatment plant. You know, so those things are factored in, it's just that it wasn't mentioned specifically. And for our organization, USAID mandates us to also provide reports. They call it environmental monitoring and mitigating reports. Your stakeholders that you are supporting, what are they doing in terms of the environment? So we are very conscious of that. And we, whether you have a donor monitoring you or not, it makes good sense that we protect our environment. I think that is very important. Over.
Okay, so my question is, oh, she on sustainability? No, but what I'll say, she will respond to it. All right, so before, because you're directed to AROC, before you came, the previous pharmacists have told us about that Mohammed, different stages in the supply chain, warehousing, different fancy graphs, procurement, third mile and all that. And then you came and said your resource center, you do things for the government, you do supply chain for, you mentioned high and top names here. So my question in simple terms, what exactly do you do for these pharmaceutical companies and this government in line with what the previous speaker has spoken so that we can tie it in? Finally, in having fake drugs, substandard drugs in the market, there's a limit to which we in practice can actually determine which is which from packaging. But somewhere, somehow, it can be traced to the supply chain management to say that seems like the surest way of ensuring you have quality drugs. I don't think I heard that in any of these presentations. So please, you respond 1 minute, and he concludes 1 minute.
Thank you for the question. So just to tie to what he said before I presented, excuse me, sorry. Like I said earlier, when you think ARC-ESM, think an organization that has set up resource platforms. And these resource platforms are resource platforms available to the government and other partners in Nigeria to access private sector expertise when it comes to supply chain related matters or issues. Now, just to outline the 3 resource platforms. So one of them is the private sector membership platform. Now, what this membership platform is, it's a resource platform where we collate local pharma companies as members of the platform and give these local pharma companies opportunities to go into PPPs with the government. And I had stated earlier that one of the, we have gone into, or we have facilitated such PPPs in Yobe State, Kaduna, and Niger State. And what the PPPs, what really they symbolize is that these PPPs are able to provide, sorry, I know 1 minute. These PPPs are able to provide the government opportunities to have a diverse supplier portfolio. So they are able to work with various local pharma companies for the supply of medicines. And just a summary of the other 2 platforms. The second one is the Center of Excellence platform. And again, like I mentioned, as much as we are making sure that we're strengthening the supply chain system, we can't do this without continuous strengthened knowledge in supply chain management. And the Center of Excellence platform is another resource platform that ARC-ESM has. And what it showcases is being able to provide access to top-class certifications from institutions to the government and other stakeholders. And sorry, without explaining the 3rd platform, the 3rd resource platform is the Hub for Innovation. So this is a resource platform that curates resources, tools, and expertise that are related to supply chain management. And like Mr. Shola mentioned, he's an expert in the Hub for Innovation platform. And also just to, you had commended FARMACOPEIAL on her success so far in supply chain management. FARMACOPEIAL is actually one of the pharmacies who is a very major beneficiary of the COE platform. She has accessed several supply chain management certifications, and she continues to access a lot of them. Thank you.
You have a comment on the fake drugs? 1 minute.
So, we have a supply chain in the country. Whether you believe it or not, we have. And the presentation there was very clear about it. You saw those circles. Foreign manufacturers, they come in, you have local manufacturers, they move on to wholesalers, they move on to the community pharmacies. That is your supply chain. Now, the challenge we have in Nigeria is, and I hope I will not sound controversial, is that we have what you call open drug markets. So those ones technically don't appear to have come under full monitoring by the regulatory authorities. I know they are doing their best possible, but our country is very interesting, and there are some challenges. I believe it's a work in progress. Okay, so, and that is why post-market surveillance is important. And I believe that the regulatory authorities are already doing that. It's just that they also need to be better resourced to do their work. Because the policies are there. Recently, it's just recently that the laws for NAFDAC were gazetted. So when you are hamstrung, there's a limitation to what you are doing. If you have the laws and you are not funded adequately, you will not be able to implement. So those are challenges, and I reiterated those things. Policies are there. There must be commitment to it.
Thank you very much. So you want to round up? After which, Professor Osifo will have a word for us after we say the conclusion. Professor Osifo, why? After you round up. Why? He has a question or something? No, because I don't like the way the young people are standing as if election is why we came here. We're trying to round up and give you space for whatever you want to do. But what we're talking about is important for you also. It's important. And for the organizers of this programming, the organizers, I think we should take these things as reasonable as they come. These are important topics. We should not be rushing. We should not be rushing. These are items we should do in a conducive environment. And then these young men should have been given somewhere else to do their elections. I'm not too happy. Look, I was PAN's president. Ask about AZUBUIKE OKWOR in UNN. Subsequently, I grew from that, became National Secretary of ACPN, National Secretary of PSN, President of PSN, President of African Pharmaceutical Forum, the first, Shola is second, the first fellow of FIP. I don't like the way you people are standing and looking as if it's unfair. I'd like to thank everybody that's been here today. You can see that it's an important topic we have not even exhausted. But we're asking the organizers, Charles, through you, we talked about the mandate to PSN, that this topic of supply chain should come at every conference in the next 5 years. It must be a major topic. We must try and get more pharmacists to appreciate what is happening. How many of us knew about the platform, what you're talking about? These are things we must benefit from. I saw the rush to join homeopathy this morning. You're a pharmacist, you are rushing to homeopathy. You haven't finished one, you want to do the other. Thank you very much, I thank you. And YPG, I apologize if we have eaten into your time. I'm sorry. Thank you very much, my brothers and sisters.
So I keep it in. My president, sir. Well done. As men of honor, I'm so glad to see every one of us. And most importantly, to make us understand, we are here to make pharmacy better. I'm also here to let you know that many better things are coming to pharmacy, because we will definitely build a united and progressive pharmacy, a family of pharmacists where you and I will be respected, where you and I will become more relevant, and where you and I will be adequately remunerated because of our contributions, invaluable contributions, teaming up with other healthcare professionals to make sure that pharmacy is respected and for the growth and development of the country. We cannot fold our hands and things will be going the way they are going, but we will be prepared to take the bull by the horn. I must assure us, particularly for those of us, both young and old, we will definitely institute the FARMD program and make sure that the consultancy cadre that has been approved by government is institutionalized all across the Federation. I must tell you that in Edo State, I work with PSN in Edo State, and it has been approved and fully implemented in Edo State. the issue of underemployment and unemployment among our youth will be properly addressed. ACPN chairman will bear me witness here. We're part of those to make sure that the community pharmacies, there's a minimum amount that you pay community pharmacies in Edo State. That will be properly looked into. 200,000, that has been instituted. Most importantly, my YPs will be involved in my administration. I will be a pilot that will allow the co-pilot to fly the plane, believing that they will do the right thing. And together we will build a greater pharmacy that will be of enviable height to everybody. We will no longer be relegated to the background. We will be front burners and deciding what happens to our society. Most importantly, we will not be reactive. We become proactive to be able to do the right thing in our country. I will definitely, mark my words, I will definitely include YPs in committees. I will definitely include YPs in the CPCs. I will definitely include YPs to make sure that the best come to us. I have a lot of leverage in FIP, and my antecedents show that. Having been invited at various, I've been invited speaker at FIP meeting in Bangkok, in Düsseldorf and Glasgow. There are opportunities for YPs, and we must take up these opportunities. The situation where things come to PSN and somebody doesn't answer will no longer be entertained. You will be participants in these administrations because you are the leaders of tomorrow. I want to encourage you to join me. Let's change the narrative on Friday and make sure that we come on board to do a new definition of what pharmacy should look like in Nigeria. Thank you and God bless you.
If you know Professor Osifo, you know you have the right man. Please, young pharmacists. Please, every young